So you can see screen now, right?
Yes.
Okay, so because this is a quite complicated study, so I basically put all the details in the slides. So I won't give any like brief introduction at first. So this is the outline of the study. So basically I will describe what this project is about and what is the study objective, and also the details or the precise of how this study is conducted, such as social listening to get the baseline statistics and also the RCT design. RCT is actually the random control and trial studies. So it's basically similar to the experiment design in the communication studies. And also I will mention some details of how we developed the intervention as known as the AI chatbot. And also I will share the data collection analysis process and also some code because we are using the R to connect the data and analyze the data, and then I will list some major contributions. First of all, I want to acknowledge all the institutions that contributed to this study. That is the London School of Hygiene and Tropical Medicine, National University of Singapore, and High Tech from Thailand. Also, definitely the School for Age and the Hong Kong University. Actually, at that time when we conducted the study, is because the pandemic situation is quite severe in those three major countries. That is Thailand, Singapore, and Hong Kong. Oh, okay, three regions. And then here is the map from the Johns Hopkins University, and we can see that all those places with red dots actually indicates the severe pandemic situation in the locals. And then the aim of this project is to develop and evaluate the conversational AI chat service, which is known in this study as chatbot, as the AI interface for users to obtain accurate and personalized information, and also to access the efficiency of this chatbot on their vaccine confidence and acceptance. So before we conduct study, we did some literature reviews and some policy reviews. We know that during the pandemic time, actually overabundance of vaccine-related misinformation was significant, challenging the vaccine confidence. And I believe this is not a this is quite a familiar topic for communication studies too, because misinformation has been long proved to hyper the vaccine confidence, not only because of the COVID-19 and not only focusing on the COVID-19 vaccines, but also the other vaccines such as the flu vaccines or HPV vaccines. And then chatbots, in Chinese called 聊天机器人, it has becoming the increasingly popular tool in the field of health field, because it can actually deliver and communicate with audiences with a more accurate and more efficient way compared with manually chat. However, right now, fewer studies have performed a rigorous evaluation of the effectiveness of chatbots, especially during time of the pandemic control. Here is the COVID-19, because we all know that COVID-19 just happened maybe 4 years or 3 years ago. And then the vaccine is quite new to the market because it's actually not undergone the yearly trial for like 12 years, because it's just released after 3 months or 4 months after the trials. So there are even more misinformation about COVID-19 vaccines. So we are thinking about, okay, maybe we can do some study to evaluate the AI chatbots and then the effect on participants or on the audience's confidence and acceptance. So the study actually have two objectives. The first one is to develop the chatbot, and this is the area I never encountered before. So actually I got stuck here for a long time, but thanks to my colleagues, they are from computer science, so they helped a lot. And then the chatbot development actually can be described in 4 ways. It will conduct the vaccine topics, such as whether this vaccine is safe, whether this vaccine is effective, or why it's important for me to get vaccinated. And also it helps to manage infodemic. Infodemic is a term raised by WHO in 2019. That is the information pandemic, because misinformation is actually damaging the public health systems, and also like sort of hyper the public health campaigns to get people vaccinated. And also it will serve as the vaccine confidence booster, because it will embed some communication persuasion theories as well, try to encourage people to get vaccinated. And also it has another function that is linked to the booking services, because Hong Kong government actually has the online booking system as well as in Singapore and Thailand. So we embedded this link in our chatbot. Then the audiences or the chatbot users, they can use the chatbot to directly transferred to the registration website, which will facilitate the whole process. And then also we conducted a randomized controlled trial to evaluate the effectiveness of the chatbot. But before we do the study, we did some social listening studies, and we analyzed the most popular social platforms in Hong Kong, Singapore, and Thailand. After the conduction here, we can see that WhatsApp is sort of like the two major social platforms in Hong Kong and Singapore, but in Thailand, Facebook and Line are the top two popular social medias. So we conducted we implement the chatbot in WhatsApp in the Hong Kong and Singapore studies. And then the chatbot was implemented on Facebook for Thailand participants. And also we did some social listening analysis. We noticed that when there is a peak of the topics, there is always some policy change or some big news. For example, the stricter social distancing measures or some like breaking records, like all of a sudden many people get infected and it's become a like big news, breaking news. And also we analyzed the sources from Facebook, Twitter, and then compared with the population which are fully vaccinated and then part vaccinated. And we realized that sometimes the users can exceed the fully vaccinated population, which gave us the thought that maybe there are some people still doubt or hesitant about getting vaccinated. So after the social listening part, we decided which social platforms to implement the chatbot. Then we are going to design the chatbot. And this is called intervention development. In Hong Kong and Singapore chatbots, we basically implement this chatbot on the WhatsApp. I don't know how many of you are familiar with WhatsApp, but this is a page of the WhatsApp. So on the left, you can see is the name of the account. It's a business account because you can see the icon here. And on the right side, here is the greeting messages when you enter the chatbot. So it's some basic introduction of the function of the chatbot, and it will give you some selections of the languages, because we actually designed the questions and the answers in different language systems. For example, in traditional Chinese, it's more like the local language, aka Cantonese. But in the simplified Chinese version, the answers and the questions are more in the Mandarin form. And also we provided in English form because there are a lot of expats in Hong Kong and in Singapore. For here, I will just focus on introduction of the chatbot platform on the WhatsApp and in Hong Kong and Singapore, because we encountered some problems when we were implementing the chatbot on Facebook when we were conducting the study in Thailand. So later on, that part was a little bit influenced. So here I will just introduce the basic functions of the Hong Kong and Singapore chatbot platform. So if you choose English or you choose any language and you type any questions you want to ask, the question will be identified with the questions we have in the data set. And then after the classification and categorizing, the artificial intelligence will help to categorize or to allocate which is the most suitable answer for this question, and will provide you the answers. So before we initially were officially launch these chatbot platforms, we already conducted several turns of trials with all the colleagues within the Hong Kong University or the National University of Singapore, try to like enhance the chatbot's performance. And then here is the workflow of how the chatbot function. So basically, the user will use the WhatsApp, and we will guide the user to type hi. Then it will show you the greeting menus like I presented before. It's like, hi, this is the chatbot from Discover4H. What can I help you? And then here is the language list. You can choose any language you want. And then after you choose the selection, after you select the region and language, you have two choices. The first one is type whatever you want, such as this. If I experience side effects after the vaccination, will there be any compensation for my loss? And also we have a list of closed questions. There is a menu, like you can select 1, 2, 3, 4, which questions are you most interested in? And all those questions are collected from government websites or from the major news streams, like what are the audiences or the public's concerns about the vaccines. And then after users enter different kinds of mode, they will be introduced to different mode. The first one is NLP mode, a natural language processing mode, which is what I described before. The AI, the chatbot, will evaluate what you are trying to ask and allocate the most appropriate answer for you. And then if you are choosing the select questions from menu, for example, many people may be just interested in the chatbot. They want to just have some window shopping, and then they will just choose any questions they want. They will be guided into the browsing mode, which means everything is fixed. And then actually the browsing mode has the most accurate answers for you. And then if you are satisfied with questions, you can go on. And if you're not satisfied, you can type the specific term, that is LANG. We put this as the return code. So if you put it, you are from the menu again, and you can start to choose or to free tap again. Here are some examples to help better understand the flow. So for say this one is NLP mode in English, I can type whatever I want. For example, is COVID-19 vaccine safe for children? And then here we'll give you some explanations. For example, the Pfizer one, and then it was actually approved by the United States FDA, the Food and Drug Administration, blah, 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 something like this. And then if I'm satisfied with this one, I will just continue asking, what should I do if after taking the vaccine and my sons, they still have some side effects? And then actually this answer is not that accurate. So this is problem where, like, if we encounter this kind of problems, we'll go back to the back platform, and we will try to adjust the accuracy evaluation of this kind of questions, and we will help to improve the chatbot's performance. And then this is the NLP mode in Chinese. Also is the same. And here is the browsing mode in English. For example, they will ask you to type in any number, and the number are listed as the 7 categories: importance, side effects, effectiveness, tips before and tips after, and also some misinformation part. And then if you type 1, they will lead you to another set or another list of questions. So you can just follow the schedules and then to have the question answered. So say if I type any number, they will just give you the information you need. But then another issue happened during the project. That is, I don't know how many of you can still recall that moment, the Hong Kong's daily coffee case. All of a sudden surged, like amount to like expect a lot, and there are many people get infected, and then more people are getting vaccinated, which caused some difficulties for us because we are still recruiting the people that are unvaccinated to join our study. And here is the timeline of how the vaccine, how the infectious cases increased over one night. You can see it's crazy. And then we're a little bit worried whether the situation will be worse and better. Then we just, refine everything and put the chatbot into study and into functioning as soon as possible. And then also during that time, Hong Kong started to adjust their policies, which means that before the children over 12 years old can get vaccinated. But right now, people from like older than 3 years old can get vaccinated. And then also the types of vaccines are also like expanded. Before only the Sinovac can be approved for children to get vaccinated, but afterwards the Pfizer are also approved, which means the capacity and also the vaccination rate will be influenced a lot. So basically, we adjust the number and the age range for the children and also the vaccination types. So the chatbot will be renewed and be re-implemented to those platforms. And also we adjust the locations, the opening hours, and all the information that will be updated following the policies updates. This is also challenging, but also shining points of the chatbot, of the AI and services, because it's quite easy to link all the updated information by typing some codes. So it's actually more effective than if you are you have to train another size of manual work or labor work to do the work. And then here is the call to action, which I mentioned before, is that we will provide a link to the official government vaccination center. So after you use the chatbot, you can actually click the link and then you will be guided into the official website and the booked appointment. And also, as I mentioned, there are many problems we encountered during the process, and we are cooperating with the major mainland company, which is called JE, to help us maintain and supervise the process. And also we can have the access to the back end, so we can see, okay, those are some questions, and we are just type in the answers here. And if any of the answers need to be updated, we have to update it manually first, and then train the chatbot to generate maybe tens or thousands of similar answers, and then to train their ability to identify the questions and then provide the most accurate answer. After the intervention was created and examined, tested for several rounds, we think the RCT is ready to implement, and then we start to design the the chatbot is ready, and then we start to design RCT, and we start to conduct RCT. The target population, due to the actually the elderly and the children are the major vaccine hesitant populations. For elderly, I think is quite easy to understand because elderly, they are more vulnerable to the diseases. And then vaccine is actually a type of system that will help you to get antibody, which means you are getting affected by this virus, and then you have the antibody, and then you get the strong immune system. But some elderly, they don't have the capability to, or they don't have the strong immune system. So at the end of the vaccination, they will have more severe side effects because they will feel worse compared with young adults or with the adults age 30 to 50, something like that. And for children, it's the same because children, they also have quite weak immune system. And because the clinical trial for the vaccination on children is quite limited because there are some ethic issues. So many parents are concerned and worried about the children's response towards the vaccination. Therefore, we choose the children and elderly as our study participants, but due to the ethical issues, we cannot get the consent or get the approve from those participants directly. So we are asking their guardians, for say children's parents or the daughters of the elderlies, the daughters or sons of the elderlies to participate, and then they will make a decision on behalf of the elderly or on behalf of their children. And here are some RCT design details. So first, the chatbot was developed and the content will cover 7 major categories. I hope you still remember, like effectiveness, safety, misinformation, tips before, tips after, things like that. And all the information and dialogues will be tailored in local contexts and languages, such as Cantonese, Mandarin, English, and Thai, because we also have the Thai version chatbot. And then this RCT is designed in 3 major Asian locations. And then all the eligible participants will be randomly assigned into control and intervention groups. And then in the intervention groups, the participants will be asked to use the chatbot for 2 weeks. And then in the control groups, they'll just do nothing. Okay, so this is a comparison, or this is intervention we have for this RCT. And then after the RCT was done, participants will be asked to complete the post-intervention questionnaire. But of course, before we initiate the RCT, all the participants are required to complete the pre-intervention questionnaire. It's quite similar as the experiment design because it's actually RCT is one of the experiment design. So you have to have the pre-survey and the post-survey, and then by comparing the differentiation of the variables in the 2 surveys, you will know how or whether the intervention is effective or not. And then here is some details of the RCT conduct. So basically, we developed the participants into 2 groups, the children group and the senior group. But just bear in mind, all the participants we have here, they are not children or senior. They are the guardian of the children or the senior. For example, here in the children's group, we are gathering the children's parents to participate in the study. And in the senior group, we are recruiting their children to participate in study. And some of you might ask why we don't have the Singapore team in the senior group study, because at that time, Singapore is actually quite positive or quite engaging towards government's policies. And then the elderly's vaccination rate is actually extremely high. So we don't have the large enough sample size, or we can say that because the elderly in Singapore, they are not hesitant as the elderly in Hong Kong or in Thailand. So at the end of it, we didn't collect data from the Singapore senior groups. And here are some flows. First of all, we will have some eligibility assessment and those who are not eligible for the studies, for example, they're already vaccinated, or their children are not old enough to get vaccinated, something like that. After the several rows, we'll invite the eligible participants and then allocate them into control groups and the intervention groups. And after several follow-ups, we lost some participants. And in the end of the study, we'll have those participants to get analyzed. So as we can see here at the beginning, we actually recruited a lot. For example, here, almost more than 4,000, more than 3,000. But at end of the RCT, because this last 2 weeks, we only gathered like 45, 65 participants. So this is also like gain and lose size of the RCT, especially the longitudinal RCT, because we are conducting the RCT if it's just one time. For example, a very typical or classic study design in communication studies is the exposure towards the message, and just after the exposure to the message, you can just evaluate the message's effect on participants' evaluation, right? But if we are doing the RCT and it's longitudinal, we have the high risk of losing our participants. Although we have incentives for them, but some of them, they just don't want to follow up. So we might lose a lot of participants during the RCT. But this can also confirm the long-lasting effects of the chatbot instead of the instinct effect. So it's like gain and loss size of the RCT. And then here I will introduce how we process the data and then some preliminary findings of our study. Before we conduct studies, we have some research background, research to prove some evidence for the justification of the findings. For say the time change and how many of them getting vaccinated. And then here's the flow chart of how we process the study. First of all, we download the data from the company we are cooperating with, because we have to collect data from 3 regions, from 3 locations. So we find a company which is called Premise to provide us with the data we wanted. And then we will have some weights of the survey due to the different population characteristics. And we want to make sure that the population we collected are national representative sample. And also we will collect the data about chatbot log information from the Stella platform, which is we will evaluate how many of them actually log in to the chatbot and how many of them actually have the conversation with the chatbot. And then we are also cooperating with JE about the chatbot knowledge base. All those kind of things we collected and summarized for our further data processing. And then also we will verify their WhatsApp numbers, and then we will by verify their numbers, we will know which participants are from which region, right? Because when we're conducting the study, we don't specifically have their demographic information at the beginning. And then if we are conducting it just from the survey, it might have some bias. So we're sort of using their WhatsApp numbers to identify their locations. For example, if a participant is from Hong Kong, actually their phone number will have the very identical code, which is called 852. And if they are from Singapore, they will have the code number called 65. So those things helped us to verify the WhatsApp users and how many of them actually engaged with the use of the chatbots. And then after several rounds of data cleansing, which is some invalid conversation, for example, maybe they just log in the chatbot, but they didn't use it at all, where they just say hi and left. Those kind of conversations or those kind of interventions are eliminated from the data cleansing process. And then we start to process data. I think you are quite familiar with this. For example, we'll change the column names into the variables name, because before it's all measurement, it's just very specific questions. But now we'll just go back to the variables. And then we will recategorize the responses, and then we'll recode the data, and then to process the data. And then start the statistical analysis. So before they're all raw data and they're not like available for the statistical analysis, because some of them are text, some of them are just merely numbers, or some of them are like they were just choose the locations, and the locations are listed as Singapore, Hong Kong, or Thailand, but all those things need to be recoded into the analyzable data. So after we recode the data, we'll start the statistical analysis. So basically we use the Fisher's exact test and the multiple regression analysis. Here are some details of how we download data. I won't go details, and maybe I just give you 2 minutes to read it. So you can see here, all of them are just raw data, which means we actually spend a lot of time on like coding the data and cleaning the data. And then after cleansing, see those are the raw data from the left side. Those are the raw data we downloaded from the platform, and then we'll transfer them into the CSV, which are very easy to input in the R. We're using the R to conduct the data analysis. After we transfer all the raw data into the CSV or Excel data-wise, we start the data processing. And then, to be honest, I'm not part of the data processing team, because they are using R, they're writing codes, they're writing like programming stuff, and then they are using all those codes to process the multiple regression or some descriptive analysis. So basically they are changing the column names, and then they were merged by user ID, which means they will merge all the answers into one line by identify their user ID. So at the end of it, you will have a list of all the user IDs, and then you will know all the information for those users. For example, the measurements from the pre-survey, the measurements from the post-survey, and also some evaluation of the chatbots, or categorize them into, for example, one participant will have one set of data, and all this data can be identified by their user ID and will be merged into one set, which will facilitate our further data analysis. Okay, there are some process of how you're recoding the data. For example, I told you before, maybe these are the answers, right? These are the answers they choose, some secondary school, some things like this, blah, blah, blah. And then we will just categorize them into 1, 0, and another number, which is no college, college, and prefer not answer. And then after this, you can see from the right side, all the value are quite clear, and also they are very easy for statistical analysis compared with the text version. Here are some other examples of how you categorize or how you recode the data. And then all those recoding things can also be conducted with R. I won't go deeper here because I already uploaded the R code in the GitHub. So afterwards, if you're really interested, you can feel free to go to the GitHub to download the codes. And here, they are using the R to have the chi-square test findings. And then from the R code, after you type all the information in, you can have the very clear descriptive analysis. For example, their income, or for example, their vaccination confidence acceptance before and after the intervention. And we'll see that in the control group, these are the percentage of how do they think the vaccine is important or not. And then how many in the Highland intervention group, how many of them think the vaccination are important, and their evaluation of this vaccination are important, whether they improved, decrease, or no change, or have the proportion here. Okay, still technology part, I won't go deeper. And here are some examples of how you conducted the R code in the page. And we also noticed that there are a lot of Filipinos and Indonesians in Hong Kong and Singapore, but to avoid any ethical issues, we didn't categorize them as domestic helpers or something like that. We just identify them based on their nationalities, and we did some subgroup analysis, which is we will analyze whether this specific subgroup of participants will have different vaccine acceptance or confidence compared with the other participants. And we think it's quite important and crucial here is because many people are conducting studies about immigrants in certain locations, for example, Hong Kong or Singapore, those kind of regions, they always have a really, really diverse population characteristics. And then after the data analysis, we have some preliminary findings. So in general, the chatbot users, their vaccination confidence or acceptance, which means whether you are willing to get vaccinated or whether you're willing to get your children vaccinated, those kind of things significantly decreased after the chatbot intervention. But also we find some decrease, for example, on their confidence in the vaccine effectiveness. For example, although I'm willing to get vaccinated, I still doubt about, okay, even I get vaccinated, will this be really effective? Like, what if I get vaccinated, but I still have really severe response if I got affected by the COVID-19 again, right? So we find those decreases. So those kind of findings give us some reflections that we have to avoid backfire effects. I will list in the contribution parts. And here are the link to the code of the data analysis and also the data size. Feel free to run the code as you see fit. And then finally, we come to the contribution parts. So this study is the first multi-site parallel randomized controlled trial. But this is really, really hard because if we want to like meet all the requirements, then the participants' characteristics are really limited, which means it's really hard to collect eligible participants. And you can see that from 4,000 to 65, how many participants we lost during the process because of virus reasons. For example, they are not eligible, they get vaccinated during the study, or they just simply give up. They don't want to continue the study, something like that. And also, we realized there is a backfire effects, which means that if you are encouraging those people to use chatbots, your intention was to encourage their vaccine confidence, that to persuade them to have a strong belief in the perception that vaccines are effective, right? But for those who are already really against COVID-19 vaccines, after you let them exposed to those kind of persuasive messages or those kind of informations, their misinformation or their negative evaluation of the vaccine might even get worse. This is called backfire effects, which in Chinese is 火上浇油,雪上加霜, which means maybe their negative evaluation of the vaccine is this low compared with the normal ones, but after the intervention, they will have this, which means they will have even worse perceptions of the vaccines because they are exposed to more reports, because we are trying to be as objective as we can. So we'll say, okay, for sure, every vaccine will have the side effects, but those are not specifically bad things, because it actually means that your immune system is functioning. And also we'll say that we cannot guarantee the antibody you got after you get vaccinated, but it's better to have antibody compared with no antibody at all. And then those people may just digest the negative aspects of our answers, and then their evaluation of the vaccine may even get worse. So this is backfire effects. It will depend on the design and the implementation of the chatbots, which if you want to design something like this, you maybe can take a lesson from this. Try to use the communication strategies to make participants or to make the audiences have a better understanding of what you are trying to deliver, instead of just focus on the bad or negative parts. And also it enhanced the equity of the population, because people with delayed vaccine intention were invited or recruited for this study instead of the general population, because we want to target the specific population to increase the whole population's vaccination rate. And also it has a lot of potentials, because here this chatbot is just for vaccination for COVID-19, but in the long run there are some routine vaccinations, such as I mentioned before, like HPV, like flu, or some polio vaccinations, because recently there are some polio cases in the States again. So those kind of routine, like every year people needs to get vaccinated towards some certain diseases. This kind of chatbots can also be implemented to help those kind of vaccination campaign for the entire society. So basically that's it.